The CDC says that lung cancer causes more cancer-related deaths in the U.S. than any other form of cancer. KX News' Corbin Warnock shares with us the importance of getting a lung cancer screening now during Lung Cancer Awareness Month.
Officials say smoking is the #1 cause of lung cancer, but it is not the only one.
Radon gas, asbestos exposure, and sometimes idiopathic exposures. We don't know where it came from. There's certainly a genetic component as well.
Medical professionals say smoking causes lung cancer because when a person smokes, they are directly taking in an absorbent amount of chemicals, but it's not just the chemicals in the cigarettes.
It actually, as it burns, creates more chemicals because those are a chemical reaction. And that comes into direct contact with the tissue of the lungs.
Cameron says one of the reasons lung cancer has a low survival rate is that it's often caught very late because there aren't a lot of symptoms.
I work a lot with lung screenings, and a lot of patients, by the time we catch the nodules or the cancer, it's already metastasized other places.
This happens because they didn't have any symptoms. It is recommended that a person starts getting screened from the age of 50 up to 80, and it's done through a special CT machine.
Anyone who's not familiar with the chest CT, you lay down on a table and they run you through a little donut machine. It takes about 15 seconds. And they use a lower dose of radiation because it is a screening.
This screening gives doctors a good look at the chest, the lung tissue, and if there is suspicious nodules or enlarged lymph nodes that could be suspicious. The testing is non-invasive.
So if we catch lung cancer early, which we often do with the lung screenings, a lot of times we can catch it prior to it going anywhere, which is ideal.
And Cameron adds that if you do happen to be diagnosed, it doesn't always mean you'll have to have chemotherapy.
If the cancer has spread to lymph nodes or somewhere else in the body, then you are looking at a chemotherapy type treatment.
But there are ways you can reduce the risk of getting lung cancer. Exercise, eat healthy, avoid secondhand smoke, get your home tested for radon, and try to avoid carcinogens if you work around toxic chemicals. But the best way, she says, is to not smoke at all, whether it's vaping or a traditional cigarette. Reporting for KX News, I'm Corbin Warnock.
Cameron says lung cancer is the leading cause of cancer deaths in both men and women. This year, about 230,000 people are expected to be diagnosed with lung cancer.